tracheotomy is a surgically created opening through the neck into the trachea. A tube is placed through the opening to provide an airway and to remove secretions from the lungs. The indications include prolonged intubation, upper airway obstruction, craniofacial anomalies, or vocal cord paralysis. In this video, we shall see the basic steps for optimal care of a tracheostomy tube. The equipment needed for suction include an inch tape, stethoscope, sterile gloves, suction catheter, wall or foot operated suction, 1 ml syringe containing normal saline, a tracheostomy kit which contains resuscitation equipment, appropriate size suction catheter, scissor, tracheostomy tie, mucus strap, and tracheostomy tubes. For suction, the depth of insertion of suction catheter has to be determined using the formula size of tracheostomy tube into 2 plus 1. Hand washing has to be done before beginning the procedure. Tracheostomy suction is a sterile procedure, hence one needs to wear sterile gloves. The assistant opens the suction catheter from the hub end without touching the inside contents, and the sterile nurse holds the hub end with the gloved hands and attaches it to the suction tubing in the non-dominant hand, ensuring that the dominant hand and the catheter remain sterile. Check the saturation. If needed, increase FiO2. The assisting person turns on the suction machine and adjusts the pressure to 80 to 100 millimeters of mercury. Disconnect and insert the suction catheter to the predetermined length without applying suction pressure. Apply negative pressure while withdrawing the catheter in a rotating manner. Duration of suctioning should be less than 5 seconds. Ventilation should be resumed after suctioning. Catheter has to be discarded after single use. Document the type, color, and amount of secretions. Always inspect the skin around the neck for any breakdown, redness, rashes, drainage, foul smell, or any signs of irritation or infection, and notify as needed. Make certain that the skin is clean and dry before securing the tube. Cotton-tipped applicators can be used for cleaning under the flanges. Start cleaning at the edge of the stoma and work in a rotating fashion outwardly. A blocked tube may result in respiratory distress. The symptoms of a blocked tube vary from mild restlessness to severe desaturations and cyanosis depending on the extent of blockage. Now let us see some troubleshooting and corresponding action points. If there is audible breathing, that is rattling or gurgling, it could be due to increased secretions or obstruction. Clear secretions by suction. If you are unable to pass the suction catheter, it could be because the suction catheter is too large or that secretions are partially blocking the air passage. Try smaller suctioning catheter. Instill 3 to 5 ml normal saline into the tracheostomy tube and repeat suction. Thank you.